Welcome back. That was the fastest break in the history of breaks. And we have Legislative Council back with us, and she's going to do a walkthrough of some changes that we made after yesterday's.
Is it posted yet?
Yeah.
Okay, I'm just making sure I'm looking at the right thing.
Welcome.
Thank you. Katie McGlynn, Office of Legislative Counsel. I'll pull up the draft. So we're looking at draft 1.1 of an amendment to H259. This is the Workplace Violence Prevention Bill with regard to hospitals. There was only one change I was asked to make. And if you scroll all the way to the end of the document, the changes in section 4, we have some language about budget review process by the Green Mountain Care Board. The lead-in language is that individual hospital budgets established under this section shall, and there had been a subdivision. This is the old version.
Yeah, I was going to say,
Do I have the wrong version up? I sure do.
seeing any.
2.1.
It should be 2.1, but I just pulled up 1.1.
One is actually posted on our website, so.
I pulled it up from
This is
where.
why I was confused, and then I
Yeah,
Okay.
I apologize.
Yellow. Is I the only one looking for yellow?
Let me give this a try. Right version? No. Also the version. Where did we get?
hate when that happens. It happens to me all the time. I'm like, this is not what I just did. The worst is when it disappears, though.
Yeah, let me look at my Word documents. Nope.
It's amazing how I can hear people breathing when it gets quiet.
Okay, comfortable.
I didn't say.
That's a good thing.
I didn't say over the old
It'd be
document.
worse if you didn't hear anyone breathing. If there are.
Well, I can tell you what it will say, and then if you want to take a break, I can.
You want to take a break? You want us to take a break and
You
you?
want us to take a break?
It's a very short
Okay.
change. So if you're comfortable with me reading it, then that will work. So the proposal from the Green Mountain Care Board is,
This was section 4.
it was section 4. They're proposing a new subdivision 7. Instead of allocate sufficient funds to ensure that the hospital is able to fully support all the costs associated with operating its security plan pursuant to section 911B of this title, which is the section created in section 1 of the bill. They instead want to say, take into consideration the costs associated with implementing a security plan pursuant to section 1911B of this title.
That's for the hospital budget review.
This is for the hospital budget
Take
review.
into account.
This was their concerns yesterday that they expressed
That exempting.
around, that it's not as easy in the hospital budget review to just like sort of throw out a whole section of the budget, but that they will, because everything that's submitted to them. So instead, they will take that into consideration.
So the difference is instead of allocate sufficient funds, it's going to say take. Can you read can you read the language that's replacing section 7 again?
I think,
I can show it to you now.
Okay, all
I
right.
was gonna say, I think we should see it.
Yeah, it's just hard for me to, I want to understand it and I don't yet. So I understand the concept. I don't understand what the language actually says.
Okay, here we go. So again, the lead-in language, individual hospital budgets established under this section shall take into consideration the costs associated with implementing a security plan pursuant to 1911B of this title. So it's a difference between allocating sufficient funds and just considering the costs associated with the plan.
So like, I see what it did.
Because they can't tell them how much to spend.
Yeah.
Yeah.
That was the thing, is before it was saying that we tell them how much, that the board would be telling the hospitals how much they have to spend to implement these things. And instead, it's that they are now just taking into consideration.
We were setting an unrealistic, I'm sorry.
Okay, if you say take into consideration, that means they don't have to.
That's right. That's where I'm struggling.
Does it have a shall in front of it?
Shall consider. They don't.
Shall consider, that doesn't mean you have to.
Yes, it does.
What you're saying is.
You can consider it, but it doesn't mean you know that. Yeah.
If I'm wrong, tell me. What we're saying is individual hospital budgets established under this section shall. And then it said, it was talk allocate sufficient funds to do it. And the new piece is they want the hospital budgets to only consider.
The
To
lead-in,
me, that doesn't mean that there's a,
Protection.
I think I see where you guys are going with this, that you're concerned that they're gonna say, we considered it and decided not to do it.
Right.
And the language that was there before says they must allocate the funds for it. I see your concern.
And that they couldn't be exempt.
I see.
Something about exempt, there was a thing.
What was there before? I'm sorry, you mean
I'm
from
trying to
like
put it
the
in.
bill as drafted?
Yeah, well,
Not in statute.
the 1.1, draft 1.1 said shall, right, allocate sufficient funds to ensure that the hospital is able to fully support all of the costs associated with operating its, and then the remainder of the language there, that's been struck out and replaced with take into consideration something that I don't remember. Exactly. And so I think their point is that's not as strong as saying it's going to be funded. It's saying they have to think about it, but what if they think about it and decide not to do it? I think that's people's concerns. I don't know how I feel
I
about it.
believe,
Yeah.
I believe that by saying it shall allocate, it's almost as though we are telling the board that they have to allocate a certain amount in the hospital budget process. And the Green Mountain Care Board does not allocate money in a budget.
Yeah, it's never been part of their,
Yes.
there's no
Yes.
jurisdiction for them to do that.
Yes. And we wouldn't want them to do that. I
No.
think that the reason they changed it, that they suggested this language change was that they, in their hospital budget review, they want to be able to consider the amount that a hospital spends on their safety in, plan that we're making them now have. They want to be able to consider that in the hospital budget review. I'm gonna go with Daisy, Mari, Leslie, Topper.
Can I just back up 1 second? Can you remind me, is the lead-in language C?
yeah.
Which should be B?
More helpful if I show it.
Oh, thank you.
So it's individual hospital budgets established under this section shall. So we're talking about the budgets, we're not
That's right.
talking about the
That's right.
action of a board.
that's
Yeah.
exactly.
So the budget shall consider blah, blah, blah. So we're talking about what the hospital's going to consider in their development of a budget. So this language makes perfect sense to me, considering that lead-in language.
Yeah, and it does say, I'm sorry, it's,
So I
Yeah,
think
that's right.
it's, when you consider how you build a budget, that makes sense to me that they have to, if we're saying they have to consider, making this plan with all these trainings and stuff, they should be responsible for considering the costs
Mhm.
that are associated with these activities. I think that's all it's saying.
That makes more sense,
Yeah.
a lot more
The
sense.
hospital.
Yeah.
Thank you for resetting us. I'm just realizing the immense importance of us actually looking at things instead of hearing it.
So that was my question. I was really struggling with who we were talking
Yeah.
about doing the allocating, so.
Yes.
Um,
Okay, so I had Mari,
I'm done. That
you're
was it.
done. Leslie?
So I see what people are saying, but first, take into consideration to me still feels soft because it means that they could take it out and I don't want them to.
They can't though, because we're requiring to do that.
The hospital budget
The hospital.
will take into consideration the costs, but what does take into consideration the costs mean? I sort of feel like take into consider would be fund. I want them to fund the program.
You're talking about the new version now.
I think I am.
We were talking about the old language.
Okay,
You're
but
talking
I'm in
about
the new
language.
version. Yeah.
It says in the previous section of the bill
What?
that they must have the program and that their budget, it says hospital shall file the following information in a manner established by the board. I summarized that a little. And it says 6 costs associated with implementing their security plan. So we're already making them do it in the previous section of the
I
bill.
would like it to say to fund the program.
That's,
It says it in the previous section of the bill though.
Then why do we need this section?
okay,
Can we,
yeah, go ahead.
can you go back, Katie,
Mhm.
to the previous section? Yeah, and explain and clarify for us,
Hospital duty.
are who is doing what here?
Okay. So this section is also in the Green Mountain Care Board chapter. Leading language here, hospitals shall file the following information at the time and place and manner established by the board. So this is what they're filing. Costs associated with implementing their security plan pursuant to 911B, including capital investments, program operation and staff. So that's the information they're filing with the board.
Filing costs. Right, filing costs.
Yes.
Yeah.
And then in section 4, this is saying that what has to be in the budgets. Individual hospital budgets shall. And then it has things like include a finding, demonstrate that they support equal access to appropriate mental health care. Take into consideration costs associated with implementing the security plan.
Yeah, I don't think we can force them to fund it.
We're saying that in their budget review submission, they need to take into consideration what it would cost to implement the plan.
And in the previous 2 sections of the bill, it says that they have to create a group that creates a plan and that they have to fund the plan. I mean, we say
Does it
that.
say they have to fund the plan?
If you look in section, hold on, I'm rewinding. Section 1 is where it talks about the prevention planning, right? Then section 2,
Well, I would, just to keep you in section 1, subsection A, it says.
thank you.
The hospital licensed pursuant to this chapter shall establish and implement a security.
Thank
plan.
you.
Establish an intimate, therefore, and fund.
But then go ahead, now you go to the next section. And that, I'm glad Katie, you did that because that's where it's requiring to do it. But then if you go to the next section, it does say that in section 3, is it? That, I'm just trying to find it. Section 2, section 3, the hospital's duties, hospital shall file this information with the board. It says their budget, so this is them reporting to the board how they're going to fund this program. And it says costs associated with implementing.
Line, I'm sorry.
I'm sorry, page 6 line.
Let's let Mari ask a question and then I'm going to make a suggestion. But Mari, ask your question first.
This maybe, I hope this is somewhat clarifying. Katie, can you go back to the language that you just added yellow
Yes.
highlighted?
Mhm.
And again, this is, the board takes into consideration during the hospital budget
This
review.
is the hospital, the individual hospital
Okay.
budget. So this is what a hospital is doing in building its budgets,
Right,
taking
back-
into consideration.
Back to the original then.
You want to see the original?
No, I'm wondering, Katie and I and the advocates at one point wanted to have the costs associated with the security planning and analysis completely exempt from the hospital budget review. But we're not doing that.
It says it's extended though. The exclusion section.
Yeah, can I make my suggestion actually? Because I think
CON,
it might help.
CON.
You are the chair.
I'm going to make my suggestion. It is 3:15 and we have all the time in the world. We have nothing else today. This time is scheduled for markup and possible vote. I suggest we start at the beginning of the bill and we do a
I love
walkthrough markup
A
of the
final
bill so that we
walkthrough.
all understand
Yes,
everywhere in
yes.
the bill. And I think maybe it will answer all of our questions.
And then we'll be jumping around less. I like this.
Yes.
Do we have Katie the
Oh.
rest of the day?
How long do we have, Katie?
Could you check in with Lori to see if they need me back? Okay. Thank you. Well, I can start. Let me
Because
start.
we had you originally at 3:15.
Yeah.
Okay.
Okay, so, workplace violence prevention plan, this is the 1911B that all the other sections are cross-referencing. A hospital licensed pursuant to this chapter shall establish and implement a security plan for preventing workplace violence and managing aggressive behaviors. Each hospital shall establish a team for the purpose of providing advice during the development of the hospital security plan. The hospital shall select individuals from the following groups to serve on this security plan development team: healthcare employees providing direct patient care at the hospital, representatives from the designated agency serving the region where the hospital is located, and representatives of relevant law enforcement agencies. The security plan shall be based on the results of a security risk assessment that addresses all high-risk areas of the hospital, including the emergency department and all patient care areas. The security assessment shall be conducted in consultation with the medical and nursing directors of each department and those hospital employees supervising other high-risk areas of the hospital. The security risk assessment shall consider overall patient volume, crime rates in the community, and the availability of law enforcement to respond to violent incidents at the hospital. The security plan shall include an option for healthcare employees who provide direct patient care to request an identification badge containing only their first name or their first name and their last initial. The security plan shall require at least one hospital employee trained in de-escalation strategies to be present at all time in the hospital's emergency department and all other patient care areas. The security plan shall require that a hospital employee trained in trauma-informed care and victim support serve as a liaison to law enforcement, support victims through the legal process, and ensure that the response to incidents of violence at the hospital prioritize the safety and retention of hospital employees providing healthcare services. The plan shall establish training requirements for appropriate hospital employees on the following: the culture of safety as determined by the hospital, response to the presence or use of weapons, defensive tactics, de-escalation techniques, appropriate physical restraint and seclusion techniques, crisis intervention, trauma-informed care and strategies, clinician well-being practices, presence and intervention of law enforcement, and safely addressing situations involving patients, family members, or other individuals who pose a risk of self-harm or harm to others. The security plan shall include guidelines indicating when a law enforcement officer should remain with a patient who has demonstrated violence or harm to others pursuant to 18 VSA 1883. The guidelines that shall be developed jointly by a healthcare provider, representative, and law enforcement. Subsection 7, a hospital shall review and evaluate the security plan developed pursuant to this section annually in conjunction with data collected pursuant to subsection B3 that we'll look at next. If necessary, the hospital shall revise the security plan. The plan and any annual revisions to the plan are to be distributed to all hospital employees, volunteers, hospital board of directors, relevant law enforcement agencies, and any other partners identified by the security plan development team. So that was subsection A. That's everything about the security plan.
And can I just?
Is there any questions about, yes,
Sorry.
go ahead.
And everything is a shall.
Mhm.
Yes.
So they have
So
to.
they have to
Develop
create
it,
one
implement
and
it.
implement it.
Okay. Subsection B, this gets into the reporting system. So the hospital that's licensed pursuant to this chapter has to establish and utilize a workplace violence incident reporting system to document, track, analyze, and evaluate incidents of workplace violence at the hospital. Data collection through the reporting system and resulting analysis shall be used to improve workplace safety and to manage aggressive behaviors, including improvements achieved through continuing education and targeted areas such as de-escalation training, risk identification, and prevention planning. All hospital employees shall be notified about the existence of the reporting system and shall receive training on how to report incidents of workplace violence to the hospital, hospital security, law enforcement, or any other entity the hospital deems appropriate. In subdivision 3, the hospital shall use this system to track the following: the number of reported incidents, the number of incidents reported to law enforcement, the number of individuals involved in a reported incident who are criminally charged as the result of the incident.
Can I stop you right there?
Mhm.
So we've heard concerns and frankly, I think they're really legitimate concerns, which is a hospital has no idea the number of individuals involved in a reported incident who were criminally charged. So is everyone okay with removing that? And
Yes.
does everyone understand why we're removing
Yeah.
it? They're not.
I was
privy to
just
that.
wondering, but
Yes.
didn't want to complicate things.
So maybe we should say on the record why is that after the person leaves the hospital has no access to the
law.
judicial system's record keeping about who's charged and who's not.
Yes, so that is information that they are unable to ascertain.
Well, I mean, they could track court dockets, but why would we ask hospitals to do that?
We're not going to.
Yeah, there is a way, there's a way you can do it, but they shouldn't have to do it. Yeah.
Well, we won't be doing.
Yeah, but because they could, but that's ridiculous. Okay. Does that mean we're striking out C?
We're striking out C.
Does anybody track that?
Track it?
Yeah, like how many individuals actually, nobody. I mean, it doesn't matter for this purpose.
Yes.
Okay.
I suppose we can talk to judiciary.
Yeah, that's actually.
I'm fine. I just,
The SVPQ again.
Here's our new
There
section.
might be
Let's
some,
let Katie.
oh, sorry.
This is your new subsection 3 without the subdivision C. Subsection C, a hospital shall adopt a policy prohibiting a hospital employee from discriminating or retaliating against another hospital employee for reporting an incidence of workplace violence. Seeking assistance or intervention from the hospital, hospital security, law enforcement, or any other appropriate entity, or participating in an investigation of workplace violence.
Hold on one sec. Daisy, do you have a?
We're up there where it said against another hospital employee.
Mhm.
Did we consider employee or contractor? Are we able to put that in there if are they a party to this? Discrimination against an employee?
I'm just thinking, I don't think you've specified contractors anywhere else in the bill with regard to workplace violence. Contractors.
In fact, we don't even make them party to having to be advised of what the security plan is.
Yeah, they're not mentioned anywhere else.
So that'd be like a DA employee, like where would it?
Well, are traveling nurses contractors?
Yeah,
They're a hospital
but they're a
employee.
hospital employee probably.
Wait,
No,
They're contractors.
traveling nurses are employed by the agency that
Oh.
hires them, and the hospital contracts with the agency to bring those nurses in.
so they're technically employees of an independent contract.
So can I finish
Can
the
I
question?
phone a friend to the side and maybe our representative of the hospitals might be able to answer the question appropriately?
Hi, Devin Green, Vermont Association of Hospitals and Health Systems. I could go back to previous legislation, but one thing we could do is say healthcare provider or employee or, because we want to capture all the employees. in the hospital.
Underemployment?
And I think the only really contracted people are typically like nurses, so maybe if we say something like healthcare provider and employee or.
Thank you for
employee.
finishing my question or suggestion. Yeah, I think we should change that from employee to something more broad to capture that, even if it's, I mean, I don't know how it's going to change the definition of
We don't have a definition.
at the top. We don't define employee.
What about underemployment?
They're not underemployment.
How about
They're employed
hospital
by a different
employee
company.
or provider?
Yeah,
Or contracted provider,
No.
or
No,
can
we
you
don't
just
want to
say,
say contracted.
but that would cover the nurses who are visiting because they're contracted through the agency, and it would cover like First Call, we're contracted provider. who works
Let's,
Okay, that ain't too bad.
let's all not talk out loud. Let's let our legislative council focus.
Shall adopt a policy prohibiting a hospital employee or, or other health, or healthcare provider?
We have,
Staff or provider?
we use healthcare worker in.
Oh, that
the
would help.
previous bill.
What if we just
Healthcare
set up a definition of employee to include,
Travel
Okay, we
employees.
have healthcare worker in section 1028. It's that's the criminal bill.
18 VSA 1028? 13?
No, it's the 13.
Before we go too far down the road, I have a question about it.
Yes.
So as with, just from experience working in the hospital as a contracted person, there are people there who are not employed by the hospital who are gonna be involved. There's EMTs who come in, there's police who come in. Are we just requiring that the people who are employees of the hospital or paid by the hospital be notified? Or is it gonna be other people coming in and working in the emergency room regularly with those staff who are also gonna know about it?
Well, first of all, we're not right here in this section that we're talking about. We're not actually having anything we're talking about employees being able to retaliate against
Oh,
other
am I looking at the wrong
employees.
thing? Sorry,
So,
I was looking at number 2. Maybe I was looking at the wrong thing. Maybe I went ahead.
so this is a prohibition and who we're trying to protect. So we're trying to protect one employee from another employee for reporting or seeking assistance or participation in.
Where are you looking? Because it's not on the screen.
Yeah.
The retaliation, but
Page 4,
so the,
line
Yeah,
19.
the statute I gave you.
but it does have that definition of protected professional, which is interesting because it picks up law enforcement officer, firefighter, healthcare worker, an employee, contractor, grantee of DCF or medical or emergency medical personnel.
Let's see.
But I think what
They're
you're,
not under control.
Where's this written?
Seems like.
It doesn't say all that there, though.
She's in-
She's
Okay.
adding.
Okay.
Can we, because I sense that
Seems like healthcare worker might work.
Katie, what are you thinking?
what I'm thinking is that what you want to do is probably broader than just this one section. I think if you're thinking you want contractors included, you probably want them to apply to the whole bill. I'm guessing. Is that right? It's not just this one subsection.
Daisy?
Is there something we can do to sort of indicate that and then the nuances of it be applied in rulemaking?
I don't think you have a rulemaking section
Not,
associated with this.
I'm thinking of a different one.
Could we say something like including? Travel,
Yeah,
healthcare workers.
I think we could do, I think there are lots of options, all of which would involve me not doing it on the spot. I could go back and every time that we're talking about an employee, I could say employee or contractor, something like that. I could create a definition of a hospital employee and I could have it include a contractor. So I think there are multiple options of how to deal with it. It's making a choice.
Yeah. I think it's important. I'm glad you brought it up, Daisy.
Hold on, I'm reading something here. So previously in the bill, we have healthcare employees into who should be a representative to help design it. Who is, I just feel as though,
Are we though?
They're already covered by what's there,
well,
I think.
hospitals can select individuals from the following groups that serve on a security plan: healthcare employees providing direct patient care.
I think that's okay.
And then it says representatives from the
So do
DAs, which
you
is what I
want
was
them
talking about, and then law
bringing
enforcement.
in like a contracted traveling nurse to be on their?
I don't think that's necessary. I don't think we need to include.
They're technically healthcare
I'm
employees
saying
providing
if
direct
we
patient care.
change if we change the word in every single
No.
place within the thing, the bill, we're going to be changing it in all sorts of places.
I'm saying that working alongside travel nurses, I don't think it's necessary or even helpful to also require a representative of contracted staff to be part of this. I think having it just be healthcare employees, active employees of the hospital, I think that's fine. We'll know what those nurses, for example, will know
I see you, Alan.
what, we're not different. A travel nurse is. A nurse. I don't know if I'm making sense, but we will be able, nurses at the bedside will be able to speak for, and we'll be communicating with travel nurses.
No, I understand that. What I'm saying is for the purposes of the bill, if we change every single place where we have healthcare employee to this broader definition of healthcare employees or contractors or somebody who walked, then we're having to change it in every single area of the
I'm saying
bill.
don't change it in every single
Okay.
area of the bill. It's not necessary.
All right, so that's what we were thinking here for a second ago, so I just want to clarify.
Well,
What we're trying to do is we want to, so now we're just dealing with the thoughts around people retaliating against each other. So so then let's stick with going to that one small section and including other things in it. Can we do that?
Yeah.
Like, or contracted?
Sure, that's a
That's
policy
what-
choice. If
Okay.
you only want contractors and the retaliation piece, then you could make that choice.
Is that how everyone feels? Does everyone feel that's okay? I want to get Alan's thoughts because he,
Okay, that's fine. I just didn't think it mattered all that much. Employee, everybody get the dress.
Topper and then Devin.
When, and I may be off base on this, but when the law enforcement comes into the hospital, they sometimes, not always, but sometimes have embedded mental health workers with them. I don't know what they're considered. I don't know who's employed them or are they the designated agencies employing? We're
Technically,
contracting with them so they be covered under contractor
But we're talking right now
about discriminating.
about one person discriminating against another person.
Or
So a
retaliating.
coworker so now we're including or retaliating against somebody who might have like walked into that hospital one time for something or other. I'm gonna get Devin's thoughts quickly and then Brian.
Devin Green with Vaz, I agree that I think it should be limited to this section. And maybe it is for sake of not messing up the other sections. Something to the effect of the wording that we've been using, the healthcare employee, or
Let's see
employee,
what I have
hospital
up there.
employee. And then I need to figure out the wording for the contract. We've used traveler wording in other places, so I'm just looking for that right now.
Okay.
What if we just put a hospital shall adopt a policy prohibiting a hospital employee or contractor from discriminating or retaliating against another hospital employee or contractor?
I'll go with it.
That's fine.
That will cover contract nurse.
I think I'm concerned about the word contractor. What about contracted employees? I think contractor is really broad.
Right.
Could be
Contractual.
contracted.
I was gonna ask about that.
How about contracted employee?
Is more specific.
Okay.
If that makes legal sense.
A hospital or contracted employee?
I was also thinking we could just get rid of like identifying people and say hospital shall adopt policy prohibiting, discriminating or retaliation for.
Yeah,
Cool.
yeah.
Okay.
Love it.
Yes.
I have some serious questions about this though, and that I haven't been able to ask yet. That,
Do you have, well,
yeah, so before people get too excited that we found a solution, and you might not care, but there's some serious things here that we haven't addressed. So it says that it's,
Give us the page.
are we still dealing on the same topic?
yeah.
Because I don't want to jump to a new
The
topic.
reason I was confused earlier is that we completely skipped over part 2 of this, but which says that employees need to be notified of a reporting system. But I don't want to go back there because let's stay focused on where we're at. That's why I was confused. We skipped that and jumped to retaliation. People didn't notice of what it said. Let's not go there right now. I don't want to get distracted. We can look at it after.
Okay.
These are related specifically to the discrimination. It says prohibiting an employee from discriminating or retaliating against another employee. It does not prohibit an employee from discriminating against a patient or someone else for reporting an incident, right?
We just changed it and it would cover that.
Okay. The second thing is that it says for reporting an incident, but the section before this, number 2, says employees shall be notified about the existence of a reporting system. I'm just trying to rectify with what you just did. It says hospitals won't allow discrimination, right, for reporting. But if we don't go back and look at who's reporting or not, I think that confuses me. So I don't want to go backwards yet. We can go back to that in a minute, but it's talking about who makes a report or not.
We're saying that the hospital has to have a reporting system and that all hospital employees should be notified about it. And then
But if
they
we,
may not discriminate against anyone or anything that actually reports an incident.
right, but if we don't clarify what an employee means, then does that mean that I'm going to have to file a report at the Howard Center when I get attacked next time and at the hospital? Because I already have to file one at the Howard Center. See what I mean? So this is where I was trying to talk about earlier, but then everyone was ahead. So I didn't want to get confusing people. But if we don't go back to number 2 and clarify that, it doesn't solve the problem. I guess this is what I was getting at. And then there's one more thing related to this section, which is it says here that you won't, and I'm just hard to keep track with looking at what's here and what's up there. So I'm gonna put my glasses on to see the retaliation part again. So if you can scroll down to the next page right there, participating in an investigation, it doesn't say that you can't retaliate for refusing to participate in an investigation. And if someone felt uncomfortable being made to be part of some investigation in which they were already traumatized, if they're like, I don't want to talk about this any further, you could still discriminate against them or retaliate for them refusing to participate. See what I mean? So I don't know, I just wanted to flag it. These are just some things I was thinking about. Like if I was at work and all this stuff was playing out, one could argue that participating includes refusing to participate, I guess. But like, if you can't retaliate for participating, well, not participating is kind of,
Could you say
Involvement in,
participation? Because participation implies that it could be that you're participating or not.
do you get what I'm getting? Yeah, you get my point there.
No, because it won't work with the lead-in. You could say participating or refusing to participate.
I think that makes sense.
that.
Well, thanks for hearing my point. And then the thing about who's an employee and reporting, I didn't want to entangle it too much, but that was an issue I had
Okay,
earlier.
all right, Alan?
I'm all set.
Okay. Is everybody good with participating or refusing to participate in an investigation?
yes,
And is everybody fine with just saying you can't discriminate?
Yeah.
I'm fine with that. That solves the issue
Okay.
there.
How does that read now up there?
A hospital shall adopt a policy prohibiting, discriminating, or retaliating for. Maybe you could say discrimination or retaliation for.
I didn't want to say it.
I didn't either.
I'm trying not to meddle too much.
With you. Yeah.
So that covers all people involved.
All right, let's move on.
Are we gonna go back to who reports or not? Or are we gonna just let it go and hope that an employee who's a contractor doesn't have to do 3 different reports at 3 different places when they get hurt now?
I don't think we can cover all that.
Yeah.
Let's just keep going.
Yeah.
Well, it's not that hard if we just looked at the words of like a hospital employee or not. But if people don't want to do it, it's fine.
I'm sorry,
I'm gonna
if
be
you
bitter when
work
I
for
have
an
to.
organization and you have violence against you in a different setting and your workplace makes you put in a report, that's something with them. If you want to say something with the hospital, then you're gonna have to put a report in there too. I'm not
So if you work for-
getting into whether or not you filed a report with some other employer and then creating a system in which they then have to be the mediary between that. Mari?
The hospital would need that information anyway. It's needs to, like, we need to collect that information of the violence that happened against you.
Couldn't the contracted employees provide a yearly report to the hospital from their system of when people got hurt working in that setting? All I'm saying is we talk about reducing paperwork, and what you're gonna do here is create another piece of paperwork that someone who got hurt is gonna have to do, where they have to tell the thing again. It's not a big deal. I'm flagging it though. That's all. There's something I noticed in reviewing it. I'm not attached. I don't care that much in the end. Like, you know, it's like
May
part of
I ask,
life.
Katie, how you're doing on time? 'Cause I am very cognizant of the fact that you have another place to be.
They said they're okay? Okay, they're okay.
Okay, thank you. Let's move on.
Okay. Subsection D, a hospital shall post a notice in a conspicuous location, either electronically or in print, indicating that hospital employees do not tolerate an unsafe work environment where any type of threatening or aggressive behavior is present. The notice shall remind hospital patrons of the serious legal consequences of assaulting a hospital employee. Then we have definition for conspicuous. Include hospital's website, waiting room areas, or any other area of the hospital that the hospital deems appropriate. Subsection E, AHS is to collaborate with hospitals to identify incentives, funding sources, and other means to support the development and operation of workplace violence prevention programs at hospitals. That is it for section 1.
Any questions on section 1? Any other concerns on section 1 that have not been addressed? Before we move on to section 2? Okay. We've closed out section 1.
Section 2 has to do with certificate of need. So it was noted before that the title is excluded, so we have a list of what's excluded from certificate of needs. So excluded from the subchapter are expenditures.
I'm sorry, go ahead.
And I know we already talked about this, but I'm just wondering if this is really important.
Okay.
Under the reporting requirements, I know we said we didn't want the hospital to get involved in reporting the number of people criminally charged. But wouldn't they need to know, or shouldn't this data be kept, the number of individuals involved in the incident?
Who were criminally charged?
No, I'm not, get rid of that part of it.
But it's the last part of
You're
it.
just
I'm
saying the
talking
number
about
of
the
individuals.
Individuals that were
Well, wouldn't the
involved.
number of incidents reported and the number of reported incidents?
That's the incident, that's one incident, but there were 15 people involved.
But the investigation should include that.
The what?
I would think the investigation would include that.
I would imagine that if there was an incident that involved one person and an incident that involved 15 people, the hospital would have quite a report on that. And
Okay. Well, we-
would you like the number of reported incidents and the number
People
involved?
number of people involved.
They're going to collect this
You
anyway.
might not be able to, I'm sorry to speak up, but if they're juveniles and all that stuff,
These are employees.
It's too much.
This is not, the hospital in their reporting system, essentially when there's an incidence of workplace violence, they have to report that incident. And they have to keep track of the number of incidents. And then they have to keep track of the number of incidents where they have called in law enforcement. And that's where we've left it.
Okay. If we don't think it's important,
I'm asking you, do you think it's important? Because we could take A, 3A, and say the number of reported incidents and those, and the number involved. Mari, I'm a
witness again. I'm thinking about our current incident reporting system, and it does go into detail about what units were involved, what departments were involved, what individuals were involved. I think that information is already captured, and I think it's too much to put that in statute. Like, there could be any number of different iterations of whether the housekeeper was involved and another patient and 2 departments, and it's kind of making my head explode to think that we would put that in statute.
they're already doing this.
There's the incident reporting system that we use has all of that in there, yes.
Okay.
But I think
Let me just understand what you mean. The incident reporting system that we use now, who's we?
that I'm speaking as a witness through my employment at a specific hospital.
Okay,
And I-
so they all know.
Yeah,
we're asking all the hospitals to do that.
Can we ask
To
Devin a
have a
question?
reporting system.
Can I ask Devin a question?
Yes, I was gonna,
Okay. Devin, does every hospital and hospital system have incident reporting systems due to liability issues or other reasons already? If you don't know, it's okay, but I'm just
I
curious.
don't know, but I mean, a lot of the hospitals that I talked to have incident reporting. And one of the reasons why it was hard for us to collect data on this was because they have their own reporting system, and then people didn't want to have to fill out our survey and that sort of thing. We're trying to make reporting as easy as possible. We don't want to create something where people are gonna have to put another field to capture the number of people involved, and we don't know if they're victims or perpetrators, and it does feel like we're going down a more complicated road.
and all of the testimony that we heard on this was that, I mean, the reason we're doing this bill is because of the disparate systems and protocols that all of our hospitals have. So some may have a reporting system, some may not. We didn't take testimony from all 14, but we know that they're all different. We're trying to get everybody to have a plan. Are you okay?
Yeah.
Okay. Okay, so I know I closed out section 1, but I gave it the 5-second rule, so you can pick it back up. We're done with section 1? Is there anything anyone wants to go back to? I really want to ensure that everybody's comfortable with this. Okay. Moving on to section 2.
So this is the certificate of need section. There's a list of items that are excluded from the certificate of need requirements, and this is adding a new item onto the list. Excluded from this subchapter are expenditures by a hospital that are necessary to implement the security plan required pursuant to 1911B of this title.
Great.
Okay.
Everybody, that pertains to certificate of need, right? Okay, good. Section 3.
Next 2 sections are from our Green Mountain Care Board chapter. So we have a section, a hospital shall file the following information at the time and place and manner established by the board. So this is what the hospital is filing with the board costs associated with implementing their security plan pursuant to 1911B of this title, including capital investments, program operations, staff.
We're just adding costs, the cost associated with it. Okay,
Section 4, this is the language about the individual hospital budgets, what they shall include. So shall take into consideration the costs associated with implementing a security plan.
right.
Can I ask a question just to make sure I understand and also so others understand that the previous section was about what a hospital has to do in its budget. This section is about what criteria Green Mountain Care Board takes into account when it reviews those budgets.
So I am not the Green Mountain Care Board expert, as you know. The way I read this is the first section, section 3, is what has to be filed with the Green Mountain Care Board. So the costs have to be filed. And I read section 4 to be what the makeup, what goes into making an individual hospital budget. So it's saying one thing that has to go into the makeup of developing this budget is a consideration for costs associated with the plan.
Yeah, I guess the reason I said what I said was that it starts with the board shall conduct reviews of each hospital's proposed budget based on the information provided pursuant to the subchapter in accordance with the schedule established by the board. And then it skips to the budgets established shall, and then it says take into consideration. So the way I was interpreting it is like when the board gets those budgets that have been filed and they review them and they're going through them, they're making sure that those budgets do all these things and we're adding in something. They're making sure that when they review the budgets, that they make sure they included the costs associated with, and I can see why they'd want us to change the language because we were saying ensuring the funds or something like that. And that's a little, so does that make sense to people? Like that this section's about,
Actually, we said allocating the funds.
yeah. So
Yes, Leslie.
I'm not sure what consideration means in this case, and that's where I'm stuck a little bit. Sure, they'll consider it, but do they protect it? How does it go into their analysis? If we just want to leave consideration, I'm fine with it, but I think it's weak, and that's all that I'm worried about. That it's not protected as a crucial shall fund. So I'm not saying we should say shall fund, because I guess that's a bad thing, but I'm just worried, I mean, and we can change it next year, whatever. We'll see what the Green Mountain Care Board does with this. They'll probably just say, it's equal to funding the nursing staff, or, we'll consider the cost of the nursing staff, or is that the same kind of language that they consider?
I see you, Daisy. I think what this is trying to get at, and I think what it actually does do is, so if you think about right now, hospital, they send the budget to the Green Mountain Care Board. The Green Mountain Care Board looks at it and they're like, we need to keep costs low. So you get a 1% increase this year. And I think what this is saying is that they now, because we've created this and hospitals have to implement it and move it forward, that the board will say, oh, they shall consider, or they should take into consideration the costs of implementing this when they do their budget review, to say they're needing to spend all this extra money. And so therefore, we're going to give them a 2% increase. I mean, these are all just.
I get it. It's fine.
I also hear your concern that it's weaker than include, or if you look at the previous bullet point, demonstrate, include, or stronger than take into I hear you.
But I'm fine with it. We'll see how it plays out. I'm going to trust the Green Mountain Care Board to protect our hospital employees, is what it comes down to.
We can always fix it next year if
Yeah.
we don't like how things turned out.
We won't even know, but that's a whole nother story.
Any other questions on this section?
No further questions, Your Honor.
All right. Is there any discussion around the bill as a whole? Do we need time to do a final?
I've been putting the changes in as we go. I think you could probably, the changes aren't so substantial that I'm super worried about you voting on them, so I think you could take a vote pending any editors changes, and that would probably work.
Okay. All right.
Thanks for your
Well,
patience.
unless we wanna, we wanna talk about that.
So just, if we're gonna take a vote, I have to text Lori.
Wait, we're taking a
Oh.
vote?
Yes, could you text Lori?
Oh, I
please?
misunderstood that. I thought we were gonna take the vote after
Unfortunately
the
already
other.
missing, Woody. Why don't we, take? Oh, wait.
Yay.
I don't even think the text got sent.
Cast it.
Does that happen every time you walk in the room? Everybody goes, I wish.
Are you like listening on YouTube like
Okay.
me when I'm not here?
No.
So are we prepared? Is everyone prepared to vote? Is there any other further discussion? Any comments? I'm sorry, Daisy, you.
No,
You had.
You said it.
Um. Oh. We missed you so much, Mari, yesterday. I just want to tell you. Do we have to do the 2 vote thing?
Oh, God.
Did we amend this?
I can do that when I make the motion, yeah.
But remember, the first vote can be straw vote.
Yeah, it's
Oh,
not,
yeah,
it's not a,
which we didn't know
Oh my
yesterday.
God.
I can take care of that.
Okay, so I would entertain a motion and
What draft number is it?
3.1 pending edits.
Well, I make a motion that we take a straw poll to accept the amendments that we've made to H 259.
I second that.
so straw poll,
Straw poll about the amendments that we've made.
all that approve of the amendments that we've made. Looks like
So you-
10-0-1.
And then I make a motion that House Healthcare accepts H 259 favorably with amendment.
Version 3.1 pending edits. Right?
With amendment.
3.1 pending edits, yeah.
Second.
Right.
Oh, we didn't need one.
Well, when the clerk is ready,
It's almost ready.
I almost said when the clerk is ready, she can take us live. She can commence to call the roll.
Representative Chena,
Yes.
Representative Cordes, yes. Representative Critchlow,
Yes.
Representative DeMar,
Yes.
Representative Goldman,
Yes.
Representative Houghton,
Yes.
Representative Page, Representative Powers,
Yes.
Representative Rebecca,
Yes.
Representative McFawn,
Yes.
Representative Black.
Yes.
The motion succeeds with a vote of 10-0-1.
And I would like Representative Cordes to be the reporter of this bill.
I accept with some Pepto-Bismol.
So this will be on notice tomorrow and pending action on Tuesday.
I'll give you a clean copy as soon as I get it from them.
Thanks, Edie.
Thank you.
Yeah, thanks.
Thank you for putting up with us.
Thank you.
Not putting up with your bill.
This bill has had a hex on it. Sorry.
Oh, yeah.
I need to feel like that with all the bills.
Yeah, I just
All
got
right.
an email
Thank you,
about it.
everyone.
With like some suggestions.
Thank you. Thank you very much. I know that this process has been really hurried. So we are here tomorrow morning at 8:30. I would ask that everybody be on time because we have very limited short time. And we can go off of live.
We check it out.